I want to welcome back now the director of the Harvard Global Health Initiative, Dr. Ashish Jha. Dr. Jha, thanks for coming back again this morning. It's so clear that this virus simply is still out of control here in the United States. We're the richest country in the world, the best medical talent in the world. How do you explain why we're doing so poorly? What must we do to fix it?
Good morning, George, and thanks for having me back on. Indeed, we are the global hotspot, and we have mismanaged this virus in a way that I think much of the world simply can't believe. And the reason is that we just haven't taken it seriously. We have not followed scientific advice and guidance. We opened up too early. We've opened up too much. We're still debating whether masks work or not. They actually do. There's no debate. So what do we need to do moving forward? We need to get people to wear masks. We need to fix our testing infrastructure. We have to close down bars and gyms and other things that cause outbreaks. And we just have to start taking the virus seriously. I think if we do all of those things, George, within the next couple of months, we can become one of the success stories as opposed to one of the global failures right now.
So some optimism right there, of course, over the next couple of months. School is starting again for so many millions of American children. We're seeing big school districts stick with virtual all over the country. Everyone wants schools to open safely. The question is how to do it.
Yeah, this is not a debate, right? We all want our kids back in school, and this should be priority number one for our country. And we don't have a national plan. And we've left it to states. States are leaving it to local towns and officials. We can't have pandemics fought by individual cities, towns, and superintendents. I really believe we can get kids back to school, but we need a national plan to suppress the virus, improve the quality of the buildings of the schools, and we can do this. We can get kids back in.
You know, we're seeing hotspots crop up here in the United States, but also coming back to places like China. New cases being reported in China. Australia, they had great success. Now it's coming back there as well. Vietnam didn't have any cases. Now they're having it as well. Why are we seeing this now? Is this still a first wave? Is it the beginning of a second wave?
You know, George, this is a global pandemic that's going to be with us all the way until we have safe, effective vaccines that are widely available sometime, I'm hopeful, in next year, in 2021. Until then, countries will continue to battle it. Most high-income countries have managed to suppress the virus. They get little flare-ups, and they're able to bring them under control. We're the only country with kind of a raging wildfire, and we really have to work on that. But even if we suppress it, we will still have little outbreaks that we'll have to deal with.
You say you hope for the vaccine by the early to mid next year, and you're describing our current situation in the United States that we're just in the fourth inning of this crisis?
Yeah, you know, I was trying to explain to people kind of a timeline, and I have thought of this, if everything goes incredibly well, as sort of an 18-month pandemic that, let's say, began around January of this year and comes to an end around June of next year. That's very optimistic, assuming that we'll have a vaccine that's safe, effective, widely available by then. It puts us in about the sort of the beginning, the top of the fourth inning. Just as a way of reminding people, we have many more months ahead of us than we do behind us. And if we don't get our act together, we're going to have a lot more suffering and death, and none of that is necessary. We really can't prevent all of it.
Dr. Jha, thanks again for your time and insight this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.